Hello everyone and welcome to CASLPO's e-forum for speech language pathologists practicing in a pandemic. We very much welcome you to this forum, but we just wanted to give you a little bit of technical advice. We do recommend closing other running applications on your computer, on whatever device you're using to watch this. It seems to help maintain a stable connection with the platform we're using, GoToWebinar. So we wanted you to know that the recording of this forum and the slides will be posted on the website, probably on Monday. We also wanted you to know that our next e-forum is going to be for speech language pathologists and audiologists providing services in the school board. So please stay alert for information about that e-forum. So my name is Alex Carling. I am the Director of Professional Practice and Quality Assurance here at CASLPO, and I'm pleased to introduce my co-presenter, Sarah.
My name is Sarah Chapman-Jay, and I'm Advisor for Speech Pathology Professional Practice and Quality Assurance. And we also want to include our moderator for the questions, Samita.
Good afternoon, everyone. I'm Samita Jaglakar. I'm the Audiology Advisor and Manager of Mentorship. And yes, you don't see me, but I am here.
Excellent, thank you. So our topics for today. We're going to be starting off with restarting patient care. We've developed some flow charts for clinics, businesses and employers, and for you as SLPs providing care in this pandemic. Then we're going to focus on profession-specific questions that we have received. Now, many of these questions are from speech language pathologists who have been providing services throughout this pandemic. And of course, we will have your questions from today. So this is how the e-forum is going to work. As we present the information, if you have any questions, please write them in the box on your screen. Samida will be monitoring the questions and we will be breaking at various points in the presentation to Samida, who will be asking your questions. Now, if we finish and there are still some unanswered questions, we will either be developing FAQs or we will respond to you individually. So today's e-forum is based on current information, both from the Ministry of Health and from public health authorities. We do want to let you know that this information is changing rapidly. So whenever we do receive information from the Ministry or Public Health Ontario, we will continue to update you. So please stay alert to your CASLPO emails and all of our communications. We're also asking you to be familiar with the webpage Providing Patient Care in a Pandemic. We have our pandemic practice advice documents there and FAQs, and we are actively revising them. So let's have a look where you can find them. This is the CASLPO homepage, and as you can see here at the bottom of the screen, we have COVID-19 information. So if you click on that, you will see a list of all of our communications that we have sent to you, as well as some FAQs and also ministry directives and information from the ministry. We also have a Providing Patient Care in a Pandemic page. You can see just by clicking there. We have many pandemic practice advice topics. We have 10. We will develop any more if necessary, as well as our flow charts. And you can see here, we have frequently asked questions that we are developing on an as-needs basis. And finally, if you missed it, we have the slides and recording for the CASLPO COVID-19 Town Hall, and we will be posting the recording and the slide for the forums here as well. So now let us get going with our first flow chart, and this is for clinics, businesses and employers restarting patient care. Now there's a lot of information here, and the information is from two documents. First, the Ministry of Health amended Directive 2 and the accompanying document, the COVID-19 Operational Requirements Health Sector Restart. So let's have a look in detail. First of all, we are asking you to carry out 2 risk assessments. Now, the Ministry of Health have actually said the organisational risk assessment is a precondition for restarting services. They want to make sure that control measures are well in place to mitigate any transmission of any infection, of course COVID-19, but any other infection. And a significant part of this risk assessment is for training and education that you will provide to professionals who you employ or who work in your business or clinic. The other risk assessment is the point of care risk assessment, and Sarah is going to cover this area very shortly. However, it is the employer's responsibility to ensure that these point of care risk assessments are being carried out with all patients. So let's focus on the organisational risk assessment. As I said, it is a precondition for starting services. And here we have the 4 areas that are the organisational risk assessment. So let's have a look at number 1, modifying and adapting your service delivery. You need to have a system to decide if patients need to come into a clinic or for you to see them in person versus seeing them through virtual care. So this needs to be consistent, and this is why they are recommending that you do actually have a system. They also want you to be employing physical distancing measures. For example, plexiglass barriers, especially if you have a reception area or a waiting room. Review all of your clinical space and consider redesigning your physical setting. Think about your waiting rooms. Think about your clinic rooms. Space out the furniture, maybe remove some of the furniture. Limit the number of patients and essential visitors attending your clinic at one time. This might mean making patient appointments slightly longer, the timings or the gap between the patients slightly longer. Again, with physical distancing, consider adding floor markings, especially if you have a reception area. And of course, provide masks when distancing isn't possible. With regard to infection prevention and control, we are being advised by the ministry to develop policies for all areas of infection prevention and control. For example, hand hygiene, office and equipment, cleaning protocols, etc. Have policies about active and passive screening and signage. We're just in a moment going to look at some signage. Consider a visitor's policy. You do want to restrict visitors coming. Obviously, if you're going to be seeing children, a parent or a guardian will be an essential visitor. If you're seeing adults, maybe the patient can come on their own, or maybe a visitor is essential. Have a policy. And when you've developed all of these policies, make sure all of the staff that work with you have access to the policies and are familiar with them. So here are some signage examples. We have them from public health and also from the ministry. So if we look at the bottom two on the left-hand side, attention patients and avis aux visiteurs, you will see that this sign is considered to be passive screening. Here you will see that a list of symptoms for COVID-19 has been included. So if you have these signs within your office, maybe outside your office, maybe even in the lobby of the building, this encourages patients and essential visitors to passively screen whether they have any of these symptoms. Finally, in the bottom right-hand corner, we have some examples from the Ministry of Labour, Training and Skills Development. And they have produced some signage more sort of for retail environments. So here are the links for your benefit for all of those signs. So you can download the signs and post them as necessary. So the fourth element of the risk assessment is personal protective equipment. Now, we have received many questions for today on personal protective equipment, and we will be addressing them later in the presentation. However, as an employer, as a clinic or business owner, it is your responsibility to ensure that your staff have adequate PPE, appropriate PPE, and that they are educated or trained on the selection, on the use, and the disposal of PPE. So that is a lot of information for both the organizational risk assessment and point of care risk assessment. So now I'm going to turn to the Citizen Advisory Group and their recommendations. Now, the Citizen Advisory Group is a group of patients and family members who bring the patient voice and perspective to healthcare regulation in Ontario. There are some 18 colleges that partner with the Citizen Advisory Group, and the latest consultation was on patient expectations of in-person patient care. So everything we have just covered, all the measures we have just covered. So the CAG's recommendations are: let the public, patients and family know what to expect about an in-person patient visit. Also, what steps are we taking as health professionals to keep them, patients, family members, and indeed yourselves safe? They recommend that all of the infection prevention control, the distancing, the PPE that we've just discussed, all of the measures that you are putting into place should be posted on your website and indeed in your clinic. Now, if you don't have a website or you don't work in a clinic, let your patients know that you will answer any questions that they might have on infection prevention and control. So, Sarah, over to you for our second flowchart.
Thank you very much, Alex. So now we're going to talk about you as the SLPs and how you are providing patient care during the pandemic. This is the overall flowchart with the legend beside it, the pandemic practice advice topics that Alex has already guided you to. So we're going to take it through the steps. The initial question you're going to ask yourself is, can the service be provided by virtual care? This would include the telephone. If it's yes to the right, yes, you can provide virtual care, go ahead. And many of you may already have begun with virtual care already. So what parts of the service can be adapted to virtual care? You are going to consider how you can adapt any of your assessments and treatments. And I'm not going to go into too much detail here because, again, it's in our specific questions area and Alex will be addressing the virtual care. Let's assume that virtual care is not going to meet the patient's need. So no, in-person patient care is deemed necessary. So before you even begin to see them in person, there are some steps we need to take. And the very first step is to carry out a point of care risk assessment and an active COVID-19 screening. So let's start with the point of care risk assessment. And this is one of our topics, number 2. Again, you can go to those resources and get a lot more details, but we're going to fill you in a bit with this today. A point of care risk assessment must be performed by every healthcare worker before every patient interaction. And this was brought home to us again in directive number 1. So what is this point of care risk assessment? It's a routine practice before every clinical encounter, regardless of COVID-19 status. It's obviously most important right now, but this is something we've routinely done always before we meet our patients. It's always based on our own professional judgment, the knowledge, the skills, your clinical reasoning, your education. You are always assessing the risk of exposure to infectious agents in each interaction, each task, each patient, and each environment. So you're going to ask yourself a series of questions before every patient interaction. Is the hazard present in the situation? Right now, obviously, the main hazard is COVID-19. So that is one of them, but there are others. You're also going to be asking, what is the health status of the patient? Are there any additional symptoms or ailments? Anything that compromises their immune systems? Could be during some course of cancer treatment, chemotherapy, dialysis, transplants. Are there any chronic health conditions, diabetes, heart, asthma? Are there any acute conditions, some delirium, some incontinence? There are all these factors to take into consideration. Then you're asking yourself, what type of task am I doing? Is it something that might involve close proximity? Will you need to do something, taking a look inside the mouth, an oral mechanism exam, doing something around the throat area with a tracheostomy? Where are you doing this task? What actions do I need to take? So the point of care risk assessment focuses on what you have control over, and it helps you decide what actions to take to protect the patients and yourself against exposure to infections. And this assessment is going to help you choose which PPE to use, also help you decide which services you're going to adapt, which are going to be for virtual care, which need to be in person. You're also going to determine when physical distancing can be taking place, as well as what equipment are you using? Where are you carrying out your services? What kind of cleaning needs to happen pre and post each patient interaction? So the other important part of step 1 is the COVID-19 screening, which is number 3 in our topics. So all patients and essential visitors must be screened for COVID-19 before an in-person visit. The screening can take place by telephone or virtual care before the in-person appointment takes place. Now, you might ask yourself a question, is it only you as the SLP that can do the screening? And no, it could be somebody in your clinic, in your center, might be an office administrator, support personnel, someone else who can help with this part of the screening. And we do say that the screening should take place as close to the appointment as possible. Now, if it is the case that you are not able to do that pre-screening, and for some reason, I think one example is a visitor, an essential visitor has come with your patient. Certainly with children, there will be an additional person. So if for some reason you have to conduct in-person screening, then you must screen a patient or essential visitor by staying behind a plexiglass barrier and wearing a surgical mask. If there is no plexiglass barrier, then you need to keep a 6-foot distance from the patient and wear a surgical mask and eye protection. Now, the Ministry of Health has also provided this information that taking patient temperatures is optional for healthcare workers. If you choose to take this step, then you need to use a thermometer with disposable single-use tips or a non-contact thermometer. So if your COVID-19 screening produces a negative result, this is when all the responses to the questions is no, you may see the patient in person. But even when this happens, when you see this patient in person, you will require a surgical mask or a clear mask or a face shield when you're with or within a 6-foot distance of the patient. You must perform hand hygiene before and after each session. If the response to any of the COVID-19 screening questions is yes, you are either deferring seeing the patient in person, or you are following the droplet and contact precautions to see the patient in person. In this case, you are going to wear the appropriate PPE, and you can see its additional items: gloves, isolation gown, surgical mask, and eye protection. You're also going to know how to don, doff, and dispose of the PPE safely. And Alex has already referred to the signage that can be posted right there where you don, doff, and dispose of the PPE and how the hand hygiene should be carried out. You're always going to be considering the intervention required and how to best mitigate the risks. Now, with the positive result of COVID-19 in the screening, you need to make sure the patient is well masked, that they carry out hand hygiene, and that they are isolated from everyone else. You and the patient are going to determine the urgency, and if it is urgent, you send the patient to the nearest hospital emergency department. If it is non-urgent, you recommend the patient is tested for COVID-19 as soon as possible. Now, in our number 3 topic advisory, you can go in there. There are links to help you find your nearest assessment center, as well as your local public health unit. And you can also see the Telehealth Ontario contact number for advice. In addition to this, when you are providing in-person services to patients, you need to screen yourself for COVID-19 on a daily basis. And again, in number 3, there is a link at the bottom of the page for self-screening. It's very self-explanatory. I went on it yesterday to check it out, and they keep updating it. It looks better each day. Okay, so that is also as important. So we've covered the important part of step 1, carrying out the point of care risk assessment and the COVID-19 screening. And we are now looking at step 2. You are always reevaluating the point of care risk assessment for each patient. It's helping you decide what PPE you're going to use. Hand hygiene is always going to be happening before your in-person appointment, and limiting visitors to those essential. Ideally, maybe only one, and you need to ensure that they also have undergone COVID-19 screening. So now we have reached step 3. You are deciding you will provide in-person care. Again, you're still thinking of focusing on the clinical activities that must be done with the patient in person. Anything that doesn't need to be in person, you can still adapt your services through virtual care or other means. At this point, you're implementing and following all the organizational policies that Alex has referred to in the earlier flow sheet, talking about infection prevention and control between the patients, thinking about your office area, the clinical space, any equipment cleaning, ensuring physical distancing wherever possible, the hand hygiene, and the proper donning, doffing, and disposal of PPE. So at this point, we've come back to the complete flow chart. We've covered step 1, 2, and 3. And you will have noticed that we also referred to all the topics. So at this point, this might be good. We've covered both flow charts, the organizational and the SLP specific patient care. Samida, we would like to turn to you and find out if there are any questions at this point.
Yes, thank you, Alex and Sarah. We do have a couple of questions on the first flow chart, so the organizational one that Alex covered. So the first question is, what do you recommend doing if your employer does not appear to be implementing updated health and safety precautions? As of yet, no revised policies and procedures, no consistency within the team as to which clients to see in person, and how in-person services should look like.
Okay, thank you, Samida. So as I said in this presentation, this is information that has come from the Ministry of Health in their Directive number 2 and their accompanying document. So what I suggest is that you go onto our website and you download those 2 documents and you take them to your employer and you show them that, as you know, the ministry said, these are requirements before you open up in-person patient care. So I would take those, I would show them to your employer. Now, if you are still concerned that no new policies are being developed, you can always suggest to your employer that they contact us here at the college. We're very happy to talk to employers. We do so on a regular basis, and we will inform them about the ministry's directives. So, Sarah, do you have anything else you would like to add?
Absolutely. I think, you know, the use of the flow chart at the very top, it talks about the directive, how to restart services. It's coming from the ministry, as well as that operational requirements. Another very valuable document that's referenced in this e-forum, as well as on our website.
Yeah.
Great, thank you. One more question about the organizational flowchart, and then one question about, Sarah, your flowchart that you covered about patients, providing direct patient care. So the second question about the organizational flowchart is, people are wondering, can we ourselves do the organizational risk assessment, or should we be depending on another outside party to be doing it? I think, yes.
Yeah. Yes, fabulous question. I absolutely think that you can do the organizational risk assessment as well. I mean, it might be sort of advisable to let your employer know that this is something you wish to do, maybe with them, but if not, doing it independently. Although we might be working for an agency, for an employer, many speech language pathologists are working a little bit more in isolation and not necessarily going to a center. So if that is the situation with you, absolutely do that risk analysis and look at all of those points from 1 to 4. And including, you know, your signage and maybe downloading, printing out some signage that you can even take on home visits. Sarah, do you have anything else to add?
I am also thinking there are a number of SLPs out there who are being contracted by others. So I think in that case, really clarify with the person you're being contracted by whose role, whose responsibility, because there is a lot of sort of pre-planning before we start these in-person services if they haven't started.
Excellent. Okay, so Sarah, one question related to your flow chart, and this has to do with the COVID-19 active screening. So the question is sending out an online screening form with the appointment reminder adequate, or does the screening need to be done by phone?
I like that question.
I know the answer to this, Sarah.
Oh, Alex will step in. Yeah.
Actually, I know the answer to this because this was one of the questions I asked the Ministry of Health on their hotline. They have a health providers hotline, which is very helpful. And they said, yes, absolutely. You can ask patients to carry out that self-screen. However, you have to be sure that they are doing it and that they are answering appropriately. So the Ministry of Health are saying that, yes, it can be done. But Sarah, I think it would be good advice to say, use your knowledge, skill and judgment to ensure that, number one, it is being done, and number two, it is being done reliably. I'm sure with some patients and family, you can absolutely trust that to be so. But maybe with others, you would be feeling more comfortable to do it yourself. What do you think, Sarah?
Yes, Alex, I agree. And I would say another question we have had related to this COVID-19 screening is that some people have said, do you have to answer every question? Can we summarize it in some way? And you do have to answer all the questions on the screening. Yes.
Excellent, Samida. Thank you very much for those questions. So we'll now move to the section of profession-specific questions, and we're going to start off with practice adaptations. And of course, the best way to adapt your service is through virtual care. Now, we've had quite a few questions from speech pathologists saying, we know we can provide in-person patient care, but is it acceptable if we continue to provide virtual care? And the answer is absolutely yes. The Ministry of Health are directing all regulated health professionals to provide as much of the intervention through virtual care as possible. And they have indicated that even when the pandemic is over, that they are going to expect this to be a standard practice of care. So you already have the knowledge, skill and judgment to plan, to conduct, to adjust assessments, to adjust treatment plans. And also, I think we are in quite an exciting time with regard to research, because there is more research coming out now with regard to virtual care in different areas of practice. So evaluate that, use your clinical reasoning, and the combination of the research, the evidence, and your reasoning will guide your professional decisions. However, always monitor, always adapt, or even redesign the intervention based on your patient's responses, based on their needs and the environment. So ask yourself before every patient interaction, how can I adapt my services to meet the patient's needs? And certainly, if you feel you do not have adequate PPE, ask yourself, what can you do virtually? So, virtual care can include, but is not limited to, all of these facets of speech-language pathology intervention. And don't forget, virtual care includes online platforms, but it also includes the use of telephone conversations, maybe emails, text messages, etc. You might use one for one facet of intervention and another for another element of intervention. But always remember, when you are disclosing personal health information, make sure that it is secure and confidential. So what preparations can be done ahead of virtual sessions? What we are recommending is that if this is the first time you're conducting a virtual session with a patient and family, maybe arrange a whole appointment or part of the appointment to get used to the technology, to do some troubleshooting, maybe find out if the child, if the youth or adult patient needs a facilitator, needs a helper at their end with the technology or with any of the tasks. Now, there are phenomenal resources being developed. They've been developed for a while, but continue to be developed. So look for written instruction sheets that you can email, look for clinical instructional apps, and research the online clinical assessment, equipment options, questionnaires, screening tools, and self-evaluation. So another question, still in virtual care. Are additional consent, privacy, and documentation requirements needed for virtual care? Now, we have recently gone onto our consent tool and added the section on virtual care. So we have developed for you suggestions, language suggestions for obtaining consent for both treatment and for the collection, use, and disclosure of personal health information. So let's have a look. So let's start off here. If you go on to our resources section of the website, all you have to do is find the consent and capacity box. Click on it, go down to the bottom, and you will find the consent tool. When you open up the consent tool, look at the settings and you will see now that the first setting is virtual care services. Decide on which element of consent you're going to focus on, whether it is the collect, use, and disclosure of information, or whether you're obtaining consent for assessment and services. And then you will find suggestions for each of the elements that are required in both consents. So I really hope you're going to find that useful. So carrying on with this question about documentation requirements for virtual care. Yes, you must document your consent, not only for your assessment and treatment plan, but also consent for virtual care. And if you are carrying out virtual care, you should be documenting that the particular session was carried out by virtual care. With regard to privacy requirements, follow the recommended privacy information, security information in the COVID-19 telepractice FAQs, and you will find them on our COVID-19 page. So just before I hand over to Sarah, we do have our new virtual care practice standards being circulated at this moment in time, and we are asking for your feedback as the major stakeholder, especially as we have all had to really familiarize ourselves with this mode of intervention because of COVID-19. So it is especially important that we get your feedback. Thank you if you have done so already. And a reminder email with links is going to be sent to you, I believe, next week. So Sarah, moving on to PPE.
Thank you, Alex. So what we have done is try to select sort of the most frequently asked questions that we have received through practice advice. And the very first one is, should children wear masks? So the answer is no. Preschoolers, toddlers, and infants are not required to wear masks, and the school-aged children are required to wear masks only if it is tolerated. And you as speech pathologists always know that there are children who would find it challenging to wear the mask. So it's only the ones who can tolerate them. But what is important is that the parents, the essential visitor of the child, must wear a mask or a face covering, something like a scarf over the mouth and nose. And you as the SLP, you must wear a surgical mask or a clear mask by Health Canada or a face shield. And that you would also consider wearing eye protection. And I feel like we've said this message a few times, but Ministry of Health is also repeating it many times. Hand hygiene before and after each patient interaction. A few more details on face shields. Public Health Ontario has said that for optimum protection, the face shield should extend below the chin anteriorly to the ears laterally, and that there should be no exposed gap between the forehead and the shield's headpiece. So it is essential that no part of the face is exposed. Do SLPs need to wear full PPE with every patient, including gloves and an isolation gown? And the answer for this is no, only for certain patients. The choice of your PPE is always going to be based on the COVID-19 patient screen, if it's a negative or a positive, as well as that point of care risk assessment. For the patients who screen positive, we know that additional PPE is required. And the whole time you will be determining the level of precaution to take to mitigate any risk of infection. So what about homemade masks that are washed daily or other non-medical grade PPE? We've had some extremely creative even photographs through practice advice of things that people are coming up with. It actually is amazing. But the answer from the ministry is that for health professionals, which would include speech language pathologists, you are to use only medical grade PPE when you are providing in-person patient care. The patients and family members, they can use homemade masks, face shields, scarves, but for you, you must wear the medical grade PPE. Should face-to-face be deemed necessary for a child, but they can't keep a mask on for the session? Would a plexiglass barrier between the clinician and the child be sufficient? And the answer to this is no, not on its own. The plexiglass is an additional physical barrier, but Public Health Ontario is still recommending specific PPE for SLPs when your patients screen COVID-19 negative and when you are with or within 6 feet distance. You must wear the surgical mask or the clear mask approved by Health Canada or the face shield. You will consider wearing eye protection. I mean, that goes back to your point of care risk assessment always. And the hand hygiene pre and post each patient interaction is imperative. Another question we've been asked is, can the college provide PPE guidance for video fluoroscopic swallowing assessments so there is consistency in the province? So let's discuss this a little bit. So the Ministry of Health has developed directives which must be followed. The expectation is that all hospitals follow advice from Public Health Ontario, but the reality is it's not a level playing field out there. Different parts of the province have different experiences. There are multiple factors related to both each individual and the environment. The number of COVID-19 cases in your region, the viral load where you work, the duration of exposure, the indoor setting, the level of ventilation and air hygiene, the type of masking that's being used. So there is no one-size-fits-all guidance. So you are still looking at what your hospital's infection prevention and control requirements and recommendations are for your own hospital-based procedures, and always still the point of care risk assessment, which will be unique to each patient in each environment. So Samita, we would like to come back to you and see if there are any questions that are related, could be to anything we've covered so far, but certainly more recently we've been talking about virtual care and PPE as specific questions as well.
Yes, thank you, Alex and Sarah. There are lots of questions coming through, so I can tell that we're not going to be able to get to them all.
Okay.
But related to virtual care, there have been a few sort of questions that are related to each other. So some questions around the decision-making around deciding to do in-person care. If the service can be provided virtually, do the SLPs have to then have some clinical rationale for why they're providing the in-person service? And I think there's some SLPs are wondering, should they be providing in-person care if in fact the service can be done virtually?
Okay, excellent. Thank you, Samita. So in answering this question, I am going to go back to the recommendations from the Ministry of Health. They are asking all regulated health professionals to carry out as much intervention virtually as possible. So if you have the ability to see patients in person, but you feel that their needs, speech language pathology needs, could be effectively met by virtual care, the ministry at this moment in time is saying, follow the virtual care route. Now, of course, the ministry does realize that some interventions are going to be more beneficial to be carried out in person. It could be the type of activity. It could be that the patient is finding it difficult to cope with virtual care, that if it's a child, their attention span is too fragmented and you're not making sufficient progress. So I think what we would say is, number one, you do have to consider, can this be carried out by virtual care? But then, as we said at the beginning of the virtual care slides, always monitor their progress. And it might be that they are not making sufficient progress, and you are going to have to change it, and you are going to have to suggest in-person care if that is at all possible. But don't forget your point of care risk assessment. A child who's very medically fragile, it might be too much of a burden to ask the family to bring that child in for an in-person visit. So ultimately, you are going to have to use your knowledge, skill, and judgment in combination with what the ministry is recommending. Sarah, do you have anything else to add?
No, I think you have captured it there. Thank you very much, Alex.
Maybe one more question, Samita, on PPE, and then we'll continue.
Sure. We do have several questions on PPE. I'm going to ask you one that's come up a few times about who all needs to wear a mask in an in-person situation. So are we asking not only the patient to wear masks, but also family members that may be present? So is it a universal masking requirement for everyone who may be involved with the patient care, in-person patient care?
So you as the speech pathologist are always wearing that surgical mask or the clear mask or the face shield. The patient or the essential visitor do have a choice of their own mask and PPE. Obviously, the surgical masks are the most, what would the word be, Alex? You know, the best protection in this infectious environment.
Yes. Sarah, I think we should also draw attention to the 6 foot, 2 meter barrier.
Yeah.
So what we are absolutely being led by Public Health Ontario is, if that barrier is going to be broken, you need a mask. So you're asking about essential visitors. So if an essential visitor is coming, of course, we're asking them to wear a mask because you're going to be screening them for COVID-19. And if they screen positive, they need a mask across their face immediately. Now, if they are waiting in the waiting room, that's one thing. But if they're going to come in with maybe their child, with their partner who's maybe had a stroke, and you are potentially at any time during the appointment going to break that 6 feet barrier, then they must be masked. So think of that as a guidance. Now, if you're going into long-term care, I can tell you there is still universal masking. Everybody going into long-term care has to be masked. Many hospitals have policies of universal masking, and we will, I promise you, keep you up to date. But at this moment in time, if an essential visitor is coming in and you have not screened them, they need that mask. If they're coming in with the session and potentially that 6 foot barrier is going to be broken, they need the mask. And as Sarah said, you always need the mask. Is that clear, Sarah?
I would still refer you to our advisories. You know, there is all this information in the advisories, because sometimes taking it in, you know, in this format, it's a lot to take in all in one go. So it's all in writing in the advisories as well.
Excellent, thank you. So let's carry on. I think we have 2 areas to cover. So are home visits considered acceptable in this climate? Very good question, bearing in mind the conversation that we've just had about virtual. However, the answer is yes. And of course, we have had speech language pathologists who have been providing home visits, community visits throughout this pandemic. But for many, it is a restart of services. So each employer and organization will have their own specific requirements around home and community visits. You are always going to be carrying out the active COVID-19 screening and point of care risk assessment to determine the risks. Now, this is where we strongly recommend that you do it by telephone, because in that telephone call as well, you can explain to them all your requirements. For example, in the home visit, physical distancing measures, asking for other members of the family to be in a different room, saying that you will be using hand sanitizer and you will be asking the patient to use hand sanitizer, that you will be masked. So these phone calls are absolutely essential before the home visit. And as we are always saying, determine if any part of the care can be provided virtually. So with regard to home visits, and to emphasize what Sarah has just said, in our 10 pandemic practice advisories, we do have a lot of additional information for community. We've called it community visits. We didn't actually call it home visits. So when you see community care and community visits, that actually is home visits. So take a look at those. So Is additional documentation required by the college? And the answer is yes. As always, you need to document relevant information, and providing in-person services during a pandemic, there are many elements of relevant information. So use your organization's policies on infection prevention and control to your advantage in your documentation. Say that you just simply followed the IPAC policies. If anyone should ever question you, if someone asks to have access to the patient record and says, well, what are the policies? You can provide them, but it makes documentation a little bit more manageable. You can even think about using checkboxes, because the principles for registrants for maintaining records, it's not only a vehicle of reliable communication and showing accountability, but it is also an ability to show your clinical judgment. And oh my goodness, you're having to use your clinical judgment even more so during this pandemic, and risk management equally as important. So Samida, we have come to the end of the slides. So maybe if we could have one more question before we wrap it up and show the resources.
Sure. So there are a couple of questions about home visits. One question is, if you can constantly maintain physical distance, i.e. be 2 meters from the client within their home, are you still required to use PPE?
All right, a good question. And the answer from the Ministry of Health and from Public Health Ontario is actually no. If you can maintain that 6 foot 2 meter distance throughout, you do not need to use PPE. However, we would recommend that potentially could be a very challenging situation for you. And we are really considering your safety as well as the patient's safety. So although the Ministry of Health are saying PPE is required when you cannot assure the 6 foot 2 meter distancing, we would say in reality, we think that that is very difficult to achieve, and that really you should be considering using PPE while we're in this pandemic. Sarah, is there anything else that you would like to add to this question?
I think that goes back, Alex, to what we talked about earlier. You're considering all the multiple factors related to each individual, each environment, the number of COVID-19 cases, all these questions. Yeah, point of risk assessment, everything.
Yes.
It all plays a part. Distancing on its own may not be sufficient. You're weighing that up. You're deciding.
Yes. This is Anita. I would also just add that the screening, the step of the screening is also very important, right? Like
Absolutely.
the patient has to have screened negative as well for COVID-19. And then you have to be able to maintain the physical distance.
Yeah. Yes.
Right. Okay.
Thank you, Samida. Thank you. So, Sarah.
Okay, so thank you, everybody. We want to reassure you, we are always here as the practice advice team for ongoing registrant support. We will offer additional e-forums. We've already spoke that the school board is certainly one that will be announced when it's ready. There will be additional revised pandemic practice advisories. We will collect frequently asked questions from this e-forum and add them to our resources. And you, of course, can contact CASLPO's practice advisors. You've met 3 of us, Samida, myself, and Alex. We also have David Beattie, who is available by email for any French-related question people asking questions in French. He is our French-speaking SLP. And we just wish to say thank you. Thank you for participating in this e-forum. We know you have the knowledge and skills to adapt your services, the training to accommodate and support your patients and your families, and you recognize how to assess the issues at hand. And you will find ways to keep providing quality services for the sake of your patients. So let's find ways to help them at a time when possibly they need this the most. Thank you.
And I would also like to say thank you very much. And just to say that the slides and the recording of this e-forum will be uploaded to the website, and we will be sending out a communication to the entire membership to let you know where they are. So with that, I am now going to close this webinar. Thank you very much for joining us. Please, as Sarah said, stay in contact.